5:25 on this Tuesday morning. Welcome back. Researchers are learning more about the social challenges facing teens with autism. A Stanford study found that the brains of teenagers with autism are not as receptive to the voices of strangers as other teens. And as a result, young people with autism may be less responsive to strangers and may find it more difficult to make social connections. Young people who vape or smoke traditional cigarettes have a diminished ability to exercise compared to young people who don't. That's according to a study in the UK that found smoking and vaping reduce the function of blood vessels, making breathing and exercise more difficult. The study showed people aged 18 to 30 who vape and smoke had a 15% reduction in fitness. And a first-of-its-kind clinical trial suggests that some dementia patients could potentially benefit from two active ingredients found in marijuana. Those are THC and CBD. The research presented at the Alzheimer's Association International Conference showed people with Alzheimer's or other forms of dementia who were exercising relentlessly, aggression and emotional distress benefited from a special formulation containing THC and CBD. But the study's authors cautioned that the supplements they used are not the same kind sold in dispensaries or online. A national blood emergency has been declared by the American Red Cross, and the organization that supplies around 40% of all blood and blood products to U.S. hospitals says it is seeing a sharp decline in donations and a surge in the demand at the same time. Mandy Gaither has a closer look at the severity of this shortage and the type of blood the organization says it desperately needs this morning.
It happens every summer. Blood donations spiral downward while demand spikes. But this year, the hit on the blood supply has gone well beyond all expectations.
In the past several weeks, we've seen an increased need from hospitals of about 3,500 units of blood each week, beyond what we would typically expect.
In the month of June alone, the American Red Cross says their supply of the nation's blood has been depleted by nearly 25%. Summer is already seen as trauma season, when hospitals tend to see more serious injuries and medical emergencies. Add in people traveling, plus July 4th celebrations and popular sporting events. It's equaled an influx of people in certain areas and an unpredictable need for patients.
When we see that our inventories are starting to drop and that hospitals may be forced to make difficult decisions, that's really when we need to put a call to action to bring donors in to help replenish those stores.
While all blood types are needed, the Red Cross says the shortage is especially serious for O positive and B negative blood, as well as plasma from donors who have type AB blood.
Someone needs a blood transfusion every 2 seconds in the United States. And so there are patients out there whose lives depend on the generosity of their community members coming in to give the gift of life.
For Health Minute, I'm Mandy Gaither.
And anyone interested in donating blood can book an appointment through the Red Cross Blood Donor app or by visiting their website or by calling 1-800-RED-CROSS. All right.